We have the best international minds here for us this afternoon, and I'm very excited to bring them out. To moderate this panel, we have, he's a member and a co-chair of the Cannabis Industry Group, and he's the member in charge of the Clark Hill, Denver office. Please welcome Robert Hoban. Robert Hoban, everybody. There you go. Is it Hoban? Did I pronounce it right? Yeah. Okay, fantastic. Here we go.
Is everybody alive out there? Let me hear a little noise. Good afternoon. Good afternoon. Bob Hoban here. Happy to introduce a really great panel. We're going to talk about policy and policy changes. Of course, policy is like the drummer in a band. It's always there. Sometimes that drummer picks up the speed, sometimes the drummer slows it down. But it's always there, and it always changes, and it dictates where things are going. It dictates investor behavior. It dictates governmental behavior. It dictates the fervor and the energy that's behind what's happening in this industry. And for this panel, we're joined by some really, really great and influential minds. To my left, Tom Zuber Lawler, out of LA, with offices in many places across the U.S. Tom's worked in the legal and policy world beyond in this space and far beyond that for many, many years. Gasper, joining us from Slovenia, also intimately involved with ICBC and the policy in Slovenia and international commerce in this space. So two lawyers down, one more to go. Ricardo, Erwin Mitchell, UK. We've known each other for many years, and it's a pleasure to sit down with all these guys. And of course, Will from Artemis Holdings. Will's comes at it from an investor and a policy perspective, but looking at it from what investors want and what does the capital in this space want to see. So when you talk about cannabis policy, you sometimes think of a policy change as the destination, but by no means is the policy change the destination. It's the work order. It's the thing that you need to build on. And it's not just the law that gets changed. It's not just regulations that implement the law. It's the interpretation of those regulations. For example, what's the pushback that we've seen here in Germany in recent months, weeks, years? We've seen this political maneuvering to sort of challenge or perhaps rein in telemedicine. That is policy in practice. That's the easy for me to say, operationalization of making things move forward, but with a slight policy change and a tweak. Now, Will, from your perspective, your group, and you've got holdings and interests all over the industry around the world. You've always spoken very highly of the German model, and I'm sure everyone in here understands the German model generally, so let's not get into the weeds on it, but why does the German model serve as a model that you think could be a model for the rest of the world from your perspective?
First of all, thanks, Bob, for running the panel, and thanks to ICBC for having us here to speak. Look, I think when Germany moved cannabis from a narcotic to non-narcotic status in April of 2024, it was a watershed moment for the industry globally. We had Canada and Uruguay already going to full adult use in their markets, but there was really no established program that had the full backing of the government to have both the concept of harm reduction met with patient service. I think that's still the theme that Germany has that's really very attractive for governments around the world, because when you open up a policy like the German government has for national cannabis, you not only aid your healthcare system providing new medicines, lower cost opportunities, better patient service, you also at least reallocate, if not save capital, on the enforcement side of illegal trafficking when you turn cannabis into a full medical product versus just being a garment in the illicit market. The absolute winning salvo in Germany was opening its borders and sourcing worldwide for cannabis, because it brought the price of cannabis down at or below the illicit market price. So that second piece, which is a very tricky piece, the harm reduction piece, is really coming into full force. There's a lot of press, negative press, which is more of campaigning against the cannabis campaigns. But the reality is you have to look at the data, and the data shows that when you open up a market that serves both a private pay patient, self-prescribing patient, which is actually who is already going daily, weekly, monthly basis to the illicit market, and you bring them into a tax and trade environment, you take the economic heat out of the illicit market. And so you go from a patient base of 200,000 patients prior to April 1st to now 1.5 million, 2 million patients and rising. And you have a shrinking illicit market, lowering costs on policing and trafficking, lowering costs on healthcare provision, and a better outcome for society. So I think that's kind of the attractive cocktail that if you look around, when everyone said, you know, it's kind of when Harry met Sally, what Germany has, I want. It was that moment that I think the other governments are looking at Germany as a model to expand into.
And Germany has gone to lengths politically to take on the overarching EU rules and EU laws. And Gasper, maybe you could chime in on that, because I think that that's something that we've maybe taken for granted, perhaps. If you look at what Germany's done as a nation, that's one thing. But within the context of European Union rules and against the UN Convention on Narcotic Drugs, and to continue to defend the program and look for workarounds. I mean, let's face it, you've got a medical model that's based on the standards that you just described, Will, but you've also got this interesting workaround with the club system, which in effect is a major policy that affects both sides of the marketplace, but at least in theory, with a wink and a nod, complies with EU law. Can you talk about some of that?
Yeah. So I agree with what Will said, and the thing is that for Germany, it was even a bit harder than for countries like Canada, because Germany, as all of the European countries, we have the European Commission above us. And in comparison to the United Nations, the European Commission can hurt you and can punish you. So for them, it was quite difficult. And for the first time, when Germany first approached them, I said, look, we want to do something like Canada, like a program where everybody could buy cannabis in specialized store. The European Commission said, no, you're not doing that. If you do that, we see you in Luxembourg, and it's not going to end well for you. So then that's why they changed their approach. And I think this is the right way for all other European countries to follow. To be honest, this is what Slovenia did. We followed the German medical program model, and we did it in a way that, to be honest, I heard Will speak a lot of times, said, look, if we have an open medical program where patient can get access to their product, then basically you don't need a recreational market. The medical market is going to serve that, and it's going to make sure that people have a safe product, they have safe access, and at the same time, you have some medical supervision. We did that approach in Slovenia and said, okay, you need to see the doctor once a year via telemedicine, but we didn't want to do it like Germany did, because we saw what happens with the telemedicine clinics and online clinics that had nothing to do with medical approach. We said, no, in order to prescribe cannabis as an online platform, you need to be a medical care provider, which means you need to have a doctor, you need to have your license from your government, and you need to see your doctor in person. It can be via like FaceTime, but once a year, to keep some parts of the medical aspects that are necessary. And for now, it worked really well. And to be honest, let's see, this is what Germany is now trying to change it into. I don't think it would be wise to ban telemedicine in general, because it's a technology approach. It's good. It's the future. So to keep patients, or to force patients to go to the doctor in person, or either at their home or at the doctor's office, is not the solution, because you have incredibly ill patients, you have elderly patients, you have people from rural regions that will not be able to do. But to regulate the platform, to say, no, you need to be a medical service provider, and I think this is the future.
So if you're a telemedicine provider in Germany, and you're looking at changing this, aside from the political angle of this, in other words, let's try to rein this in a little bit, what is the other motivation? Is there any policy motivation to limit access to medicine like the same that you have for other medicines and cannabis? Is it just political motivation?
I think it is, and it's not just a political motivation. It is, at least I look at it that way, that if you're not really limiting access to medication, because you can do it. It can be as open as it is, but it has to be regulated. Because in my opinion, if I can go online and it takes me 2 minutes to get my prescription and my product is already on the way via post, this has nothing to do with medicine. If Germany would say, look, we want to go fully commercial, then I'm okay with that. But if we want to say this is under a medical auspice, then there needs to be some regulation and some licenses. And I think in the end, it's going to benefit the patient or the consumer, however we want to call them, because it's going to be better access, and it's going to be, I mean, there's a lesser chance that the governments will want to intervene in the future with some regulative changes, like we are seeing right now. It's a question if they will do it, because I think also the German government is aware that it's a big market. I think it was last year, it was 1 or 1.5 billion market, so they don't want to change it in completely. Sure. But I think some regulation is in order.
Ricardo, when we talk about different standards, different supply chains, different definitions of what medical cannabis is, let's take the UK. And there's legends of what's happening in Jersey and Guernsey and all these different places.
Can't comment about that.
Help us understand what UK's role in the supply chain is right now from a policy perspective.
I'm going to touch on both what Will and Gaspar have said, because I think it ties in. Obviously, the UK is not part of Europe, even though it's still part of the European continent. Our policies, when it comes to medicine, and that's what we're really discussing, and that's the playbook that cannabis has fallen into when it's Europe. We can't forget that Europe and the UK follow what's called pharmacopoeia. And we can't forget that we are talking about an unlicensed medicine, and they are within both European countries and the UK. There are guidance when you deal with unlicensed medicines. What was great about Germany doing what they did with Cangi and recreational was positive, because you're trying to limit the illicit market. What that does create, unfortunately, is a cannibalization of the medical playbook, because what happens is you've got operators in Canada and whatever thinking now it's open season, borders are open, I can bring anything in and I can blur the lines as to products and finished products. And what we saw in the UK, we've not changed our policy or legislation since we became legal for medical cannabis, but what we saw was that was misunderstanding or lack of education or lack of wanting to understand that you couldn't bring finished goods into the UK when it was unlicensed medicines. And I think some of our UK operators, again, uneducated of what pharma was, allowed that to happen on their watch, and there's been a tightening of those rules. I think we should take that as a positive. It means the regulator focused on it. They haven't closed the doors. The doors are firmly open for the right partners to still collaborate with the UK, because as what's happening in the UK, we've got farmers and there's growth facilities, but we're not yet, and hopefully we will be at one stage, at the same point as the farms in Canada and elsewhere across the globe, including Portugal and what they've done in the last 4 or 5 years. So unlike Germany or unlike Slovenia, the UK hasn't changed. It's still vibrant. We're not at the close to 1 million people patients. We're only at 80 to 100,000 patients. But hopefully this time next year we'll be closer to 200,000 patients. And it's about how do we become compliant, transparent, and how do we harmonize that with the other countries that are vibrant at the moment, like Germany, like Portugal has cultivated, like Slovenia, are working collaboratively with their governments to say, actually, telemedicine's yes, medical yes, but we don't want to let the horse leave before the cart, sort of thing. So it's about dealing with it in the right way. So I hope that kind of answers your question.
No,
and without dealing with Jersey, Guernsey, or anything like that.
If I may just jump in, I loved how you said the cannibalization of the medical rules. I love that because this is kind of what is happening with a lot of products, and sometimes I would like to have more product available in the European Union or in a European country. Like here, every time I walk the ICBC, I see all of the beautiful products. Like somebody came to me, offered me some sublinguals, amazing, great. And he said, could we sell that to Europe? I was like,
Not yet.
no, not yet. It's a finished product. And then, of course, you want to start, and we started thinking about it and talking to our QP, and then you kind of get to, okay, so if this would be a whole sheet, and we try to cut it, and this is when the cannibalization of the medical rules is happening.
So I came in, dealing with the word cannibalization is something that I raised about. I've been in the industry for 6 years. I'm a lawyer for about 19 years. I'm a litigator by training. And I used to go to a lot of conferences that were actually geared to doctors because I wanted to understand, the medicine side, because I'm not a life sciences lawyer. I needed to understand the topic. And obviously, everybody has seen what's happened in Canada previously with medical, recreational, and so on and so forth. And hindsight and foresight are wonderful things as human beings that we can look at what someone else has done, but do we want to follow in the same path? And I raised this question about 4 years ago. Why do we talk about medical and recreational at the same time? Governments will find that difficult to deal with at the outset. I'm not saying that they can't coincide. What I'm saying is, do we go for one path, and if we start talking about the other, do we cannibalize the positive discussions that are still yet to develop? Because irrespective of what anybody discusses about prohibition, and cannabis has been around for hundreds and hundreds of years, this is still very much an emerging market in Europe. And we have to treat it as such. And we have to educate the regulators as much as the regulators educating us or our clients or contacts of what they expect from a product that goes on the market. So that when I discuss cannibalization, it's not deliberate, but it becomes an accident that happens because everybody's so happy, they're so positive about the industry that they want to be a part of it, and it's all positive enthusiasm, but ending up becoming a negative narrative that the press then use to say, well, we warned you about this.
Yeah.
Well, listen, so when you guys are talking about international commerce around the plant, around these goods, talk about bringing products into different situations, we've got the U.S. sitting back. There's not international commerce per se. There's some on the hemp side, but neither here nor there. On the truly cannabis, the high THC product side, not really happening yet with some very limited exceptions. The United States has announced a plan to move towards Schedule 3. That has not come to fruition yet. Could be mere scheduling, could be the rulemaking process, could be political. Tom, what happens if the U.S. moves forward with rescheduling, and how do you think that affects what we're talking about here, the shipment of these goods all over the world?
Well, I mean, it changes everything. It's such a big question, Bob. First of all, it's great to see you, Bob, always, and everyone else on the panel. It changes so many things, and we're talking about the medicinal market existing alongside the recreational market in European territories, and the sort of antagonistic relationship sometimes between those two different markets. In the U.S., we obviously have quite a phenomenon going on where we have illegality at the federal level existing on top of legality at the state level and at the local levels. And that's been a nice big mess in the United States, as I'm sure you've all heard. And Bob and I and others in the United States have been waiting patiently, including some folks here in the audience, for the light to go on, the green light to go on, so that we can start moving THC across the border in the United States. So of course, when that happens, Bob, if Schedule 3 does happen this year, or it happens sometime soon thereafter, the whole game changes. First of all, within the United States, for folks looking here to enter the United States and do commerce there, all of a sudden you're going to have movement of THC product across state borders in the U.S. That changes everything. Right now what happens, and in Europe it may be hard to really relate to that because you can move cannabis across borders here, right? with obviously complications and regulatory compliance and so forth. In the U.S., you can't do that, period. If you're in California and you start a brand and it's very successful and you want to move into Colorado, you got to call Bob and you got to have him help you set up new operations in Colorado, de novo, and that's the nightmare that it sounds like. And maintaining quality control, imagine that, where you literally have to have completely different operations in these different states and doing that across multiple states. That all goes away. So then what happens to the U.S. cannabis industry at that point? You're going to have places where you get premium cannabis. I mean, as well done as cannabis gets in places like California and Colorado, perhaps Canada, just places that have been doing it for so long, for decades. So the cannabis is top notch. You've got a $6 billion industry in California. Your first thought is, let's go to the biggest market in the United States if you're coming here from Europe. But of course, that has to be considered in the context that that's a very, very developed market. You really need to know what you're doing. It's very easy to lose money and go out of business. And so you may want to choose, instead of going to California, you may want to decide that you're going to go to another market that's maybe only medicinal, and there's a very limited number of licenses. And that sounds like a great idea because there's much less competition. It's much earlier on, and frankly, companies make a lot more profits. It tends to be the case in those underdeveloped markets. It's still the boom years, so to speak. But then you have to deal with operational expertise, which doesn't necessarily exist in those new markets. So you've got completely different challenges. So a lot of those challenges start to go away. When you're looking at cannabis coming across the pond from the U.S. over to here, which I think will happen as well, obviously, you've got a whole different host of other issues. Bob, you and I were talking recently about GMP compliance and how important that's going to be. And in the U.S., you're not going to find it like you do here in Europe, right? Because you don't have many GMP-compliant facilities in the U.S. producing THC and THC products. That's going to change, but it's not going to change overnight. And in the U.S., we have, I think, a hesitancy to invest in long-term projects because companies are so burdened by the tax constraints of 280E, which is the tax code provision, the U.S. tax code, that says that you can't deduct most of your expenses in the context of producing THC product, which is still on Schedule 1 of the Illicit Substances Act in the United States. So what that means is those are most of your profits, right? If you can't deduct your salaries, you can only deduct cost of goods sold, you can't deduct so many other expenses, you really have cash flow issues, and that means these companies really don't want to think too much, not because they're not visionaries, they are, not because they don't understand that the game will completely change when you have to have GMP compliance in order to get the product from the United States to Europe, but because it really becomes a day-to-day survival conversation for so many companies in the United States in a way that I think will probably go away to some extent when Schedule 3 flips. But at the same time, you're going to have companies that really need to work on making that transition from a non-GMP facility to a GMP facility so they can get to Europe. So I think in terms of European companies looking in that direction, it's important to start making partnerships now with folks that really understand that steps should be taken today to become GMP compliant the day that light shifts, right? The day that the light comes on, and we're no longer in a Schedule 1 situation, we're in a Schedule 3 situation. So many things to unwrap that, and that's a bit much, but there's so much further we could go because the answer to your question, I guess in a more succinct sense, is everything changes when Schedule 3 flips.
You know, we talk about Schedule 3 preparedness as a concept, right? Schedule 3 preparedness is really what your baseline licensee in these European countries already has in place because it's those standards, they already exist. Will, do you think if the U.S. reschedules, if that ultimately gets over the finish line, and if there's a pathway for cannabis companies to register with the DEA or the U.S. government, that impacts the existing supply chain globally? I mean, you've got lots of imports coming into Germany, from Colombia, from Thailand, from South Africa. The list goes on and on and on. That's happening right now. Does the U.S. become a player in that? Or are things coming into the U.S. or both?
So I think the impact for those players that are already doing their homework will be immediate as far as what happens to their P&L, their balance sheet, and their opportunity. And I've had inbound calls from the companies that we have in our portfolio, as well as folks that we just know, very large producers in the US, to say, what is this EU GMP thing, and what do I need to do to get arranged? I'm like, okay, completely different mindset. So first of all, you have to have two minds. There's a US adult use market. That's one way of running your business. Completely different way on running your business looking at the international markets. And it's not even a matter of whether you need or don't need the adult use market in the future. There's only one market right now, which is medical. And so you have to have a GR focus, a government relations focus, and a tops-down mentality for regulation. It's not going to happen from public referenda in the newspapers and then a vote. It's going to happen because regulators are being asked by government to make a change, and then they're putting the ministers into action to make those changes and create policy. So the first thing is, it will absolutely agree completely with the view that Schedule 3 is going to radically change the complexion of the international cannabis market, because it will remove cannabis as a narcotic from one of the largest players and provide a medical pathway. As far as going back into the US markets, it really depends on what the US does with it. We're seeing already with Kessler pushing through these changes for CMS to reimburse on CBD. If we get THC products in there, we actually get reimbursement, there's a real viable market, and there's capital that's going to flow to the producers, then I can see, just like India penetrated the pharma markets with API, I can see API flowing into the US markets from very inexpensive sources from outside. But the mountain to climb to get there is pretty high, especially when you have a lot of folks that are going to be running around the US with grow facilities that they need to repurpose as the price of cannabis comes down. Because I do think that super premium is going to hold a place, but value and medical are always going to be cost competitive. And so you need to retool your entire thinking on margin as well. So it's an opening shot. As you said, this is the starting gun, not the finish line. It's an opening for a lot of opportunity, but it's going to take some time before pathways get really set in stone.
And Ricardo, with the fractional approach to global policy, you look at the UK as a non-EU member participating meaningfully in the supply chain. How do you see that as the US? What's the analogy there? Does the US play like UK plays, or does the US not play at all because ultimately the Schedule 3 environment is just not defined? It's a square peg in a round hole.
Well, that's a long question, and
You're
it's
gonna
just
make
come
your
up.
answer brief?
Right, I'm going to leave it on a positive.
Yeah, all right.
Since my 6 years in the industry, it's the first time that I've seen a prime minister of my country discuss cannabis on a medical play twice in open house. So the UK, irrespective of Europe, we've been a long-standing partner of Europe, having deals. I mean, being Portuguese by blood, it's the oldest treaty on the planet. I think it's open, there's positives, but going back to what Will was saying and everybody else, it's about correct government and compliance and regulations. And he's gonna scream at this because I created this terminology in front of him. What the industry needs is more THC, transparency, harmonization, and collaboration within the industry, but with the regulators. And once you get that right, then you can harmonize all of this properly.
That was the shortest answer you ever gave.
Oh, no.
I hate to cut you all off. That was fantastic. I could listen to it for another half an hour. Let's hear it. Thank you all very much.